Hello, this is Dr. John Whitfield. We've been talking about treatment of heavy periods, and more specifically, the endometrial ablation. Let's go ahead and recap a little bit. Heavy periods are very common. Probably 1 in 5 women will experience heavy periods at some point in their lifetime. Most don't seek care for it because they think A, it's just part of being a woman and something that they're going to have to live with, or secondly, they think that major surgery is their only option. Now, there are several causes for heavy periods. Common causes include things such as hormonal imbalances, uterine fibroids, which are muscle tumors of the uterine wall, polyps, a condition called adenomyosis, which is a downgrowing of the lining of the uterus into the uterine wall, which causes pain and bleeding. And of course, the thing we really worry about is some type of precancerous or cancerous overgrowth. Sometimes we work patients up for abnormal bleeding and we can't find any cause, and these patients are labeled as having dysfunctional uterine bleeding. Now, there are lots of ways to treat abnormal bleeding. Once we determine the cause, that will dictate what treatments are available. And I like telling patients there's usually probably about 5 or 6 options that they'll have. These include, number 1, observation. In other words, there isn't anything bad going on, such as a precancerous or cancerous overgrowth. The condition is benign, they're not anemic, and so they can simply just continue to observe their periods. The second option would be medical therapy. This would be to take some type of medication that would slow the periods down. Number 3 would be hormonal treatment, such as with birth control pills or other hormones. Fourth would be a medicated IUD, and for some women this works really well because it gives them contraception in addition to helping with their heavy periods, but it's only good for about 5 years. The mainstay traditionally has been a hysterectomy. Again, we're talking about major surgery, a hospital stay, and an extended time of recovery. Something that we're doing more and more now is the endometrial ablation. Let me explain how it works. Here's a picture of the uterus, and normally during the month, it's this uterine lining that builds up throughout the month. At the end of the month, if conception does not occur, it's this lining that sheds, and as it sheds, it produces menstrual flow. The thicker the lining and the more shedding, the more menstrual flow. An endometrial ablation is a procedure where we go in and we literally shrink down the endometrium, the lining of the uterus, in a procedure called an ablation, and there are several ways to do that. Many techniques are out there to do the ablation. Traditionally, it was done in the hospital. There are now some methods that we can do and actually do those in the office. One of these is called the HerOption cryoablation system. And with this particular technique, we use a freezing technique. It's the same freezing technique that's used with liver tumors and with prostate tumors. And the way it works is we use a special probe, place it into the uterus, and then using the freezing technique, ablate the uterus. The results are very good. Taking a large group of women and going down the road, probably 50% will tell you that their periods have significantly improved to where they have only very light bleeding, spotting, and some stop having periods altogether. Another 35% have marked improvement. Marked improvement is the patient that bled 10 days per month, 10 pads per day, now bleeds 3 days per month, 3 pads per day. 15% flat out fail, it doesn't work. These are patients that need to consider a hysterectomy. Now, who would want to get an endometrial ablation? There are 2 major groups. The first group are those that want some type of conservative surgery for their bleeding. They don't want to be on medications, they don't want an IUD, but they're not ready for a hysterectomy. They want something more conservative. The second group are those who are at a high medical risk for major surgery, such as those with significant heart disease or lung disease. The cryoablation system is great because it's done right in the office and patients are able to return to work the very next day. The patient comes in, she spends about an hour, hour and a half in the office having the procedure, and then goes home. Many patients are choosing the cryoablation versus other ablation systems for a couple of reasons. One is, and typically what I hear in the office is, I don't want to have to go to the hospital, I don't want an IV, I don't want to be put to sleep. And with the endometrial ablation system, with the HerOption, the cryoablation system, it's ideal for these patients, and we've had a great success with it. Now, ablations are not for everybody. You need to see your doctor, be evaluated, and find out if this is an alternative for you. Again, this is Dr. John Whitfield, and I'm a board-certified gynecologist. My staff and I look forward to the opportunity of meeting you and taking care of your needs. We offer timely appointments, specialized care, and a level of service I think you'll appreciate. Give us a call today.